Well, good morning and welcome everyone to Gut Check, a GI Q&A with Kristen Johnson, a board certified physician assistant with Beaufort Memorial Low Country Medical Group. We have a number of questions from those of you who have registered, and we appreciate that so much. So we are going to jump right in and we'll start with your questions. So thank you, Kristen, for joining us today.
You're very welcome. I'm looking forward to this.
Great. Well, like I said, we have a lot of questions. We will get through as many as we can, and if we miss some, we will be happy to email the people who submitted them, and with Kristen's responses. So let's go ahead and get started. So the first question is, do you have any pre-prep tips before I have a colonoscopy to make it easier?
Yes, definitely. In our office, we have many patients that are very hesitant to undergo colonoscopies because of the fear of the prep. I think the prep has gained a bad reputation through the years. So the first thing that I want people to remember is the end goal in sight. And the end goal is to provide our physicians with the ability to visualize the lining of the colon so that they can diagnose colon polyps, which are the precursors to colon cancer, and eventually save your life. Colon cancer, we know, is the third leading cancer in America, and it's the second leading cause of cancer death in America in both women and men. And in fact, 1 in every 23 men in America will have colon cancer, and 1 in every 25 women, which is frightening. And this is a cancer that can be prevented. We just have to have colon cancer screening via colonoscopy. So I want people to remember, although it's not fun, we remember the end goal in sight. There are some things that you can do to make the prep more palatable. You can mix the prep with flavored beverages. So for example, you could use Crystal Light. You could use Gatorade. You could use white grape juice. You could use apple juice. So anything that is clear. So if you pour it in a glass and you can see through it, then that is something that you can mix with the prep and it will make it more palatable. And I suggest mix several things so that you don't get sick of the same thing throughout the day. Additionally, you can try drinking it through a straw. That's going to make it a little bit easier. And over time, people will feel full and they may feel sick. Take a break, walk around, take a deep breath, and you will get through it. And then finally, be prepared. Get all your materials ahead of time so that you're not running to the store at the last minute. And have wet wipes. Have some comfort measures there at home because you will be going to the restroom very frequently. And then finally, you can have hard candy up until midnight the night before. So you could suck on hard candy or lemons or anything like that just to have a different taste in your mouth. So those are some pointers that we give our patients. The only thing that I would want to remind everyone is if you are mixing the prep with, say, Gatorade or juice, you do not want to mix it with anything red or purple because it can sometimes cause the appearance of blood in the colon. So we don't want that to happen.
Okay, great. Thank you.
Mm-hmm.
So the next question is about irritable bowel syndrome. The question is, does stress make IBS worse?
Definitely. We see it every day. Emotional stress and meals may definitely exacerbate patients with IBS. The digestive system is very complex, and some people call it the second brain. So the way that the digestive system works is through the autonomic nervous system, which is divided in the parasympathetic and the sympathetic systems. So the parasympathetic system is known for resting and digesting. That's what we want our system to do when we take a bite of food. We want to be relaxed. We don't want to be stressed. We want our body to be able to process the food, absorb the nutrients, and handle this whole process correctly. Unfortunately, a lot of us today are in the sympathetic mode throughout the day, which is fight or flight response, where our body is in this mode of going, 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 and we don't take time to relax. So our body is not able to digest our food properly. So I would encourage our IBS patients to find ways to reduce stress in their life. Exercise, take a deep breath, go outside, get fresh air. And that definitely can improve their symptoms and control their overall stress in their life.
Great. Thank you. Very helpful. The next one is about fiber. The question is, I've tried to include more fiber in my diet, but end up feeling bloated and gassy. How can I get the fiber I need without increasing the gas?
So we hear that a lot as well. Number one, I would say start with a small amount of fiber and go slowly. So try not to start with a large amount because that's going to be hard for your body to adjust to. I would say use a half to 1 tablespoon daily of fiber at first, and then titrate that up as tolerated. Additionally, make sure that you're hydrating well. If you eat a high fiber diet, but you're not drinking water, then that's going to cause a lot of cramping, bloating, and pain. And then also for people that tend to have gas and bloating, I would suggest that they may research the low FODMAP diet. That's something that you can find online very easily, and it reduces foods that are gas producing foods, and that may help with that as well. And just so you know, most Americans eat about 16 grams of fiber a day, and the recommendation is 20 to 35. So we're all guilty of not eating enough fiber. It really improves our digestive system. It's going to aid in pushing that food through. So everyone, try to increase your fiber, but do it slowly.
Great, great. The next question is about gallbladder pain. So, what can I do to minimize the pain my gallbladder issues are causing without surgery?
So when you eat or even drink anything, your gallbladder starts contracting and squeezing. And what it's doing is it's releasing bile. And bile is produced by your liver and stored in the gallbladder, and it aids in the digestion of fat. So anytime you ingest, that gallbladder is going to contract. Unfortunately, with gallbladder disease, people will start having pain, gallstones, and sometimes those stones will inhibit the release of that bile. So we have found that a fatty meal is going to make that gallbladder contract more and may make it worse. So the key is a low-fat diet. So people need to stay away from fatty meats. I would suggest staying away from fatty dairy products such as whole milk, fatty cheese, margarine, anything like that, chocolate, whole milk, ice cream, the list goes on and on. So a low-fat diet definitely has been shown to decrease the symptoms of gallbladder disease.
Wonderful, wonderful. The next question is, what food should I avoid to help control GERD?
GERD is probably one of the most common complaints that we see throughout the day in our clinic. So for GERD, there are many things that you can do as far as modification of diet and lifestyle. My daughter just came in. Sorry, guys.
That's okay.
So the first most obvious thing is highly acidic foods. So citrus, tomatoes, those things typically exacerbate GERD. Also, we found that caffeine does. So people that drink a lot of coffee or tea during the day, reducing that will help. Alcohol can definitely exacerbate GERD. And then also some other things that people sometimes forget are chocolate and mints. I have people surprised every day when I say that, because sometimes people feel like mints help their GERD, but actually mints can make it worse. And then finally, it's important to eat smaller meals throughout the day, avoid eating large meals, and avoid eating right before bedtime. So you want to give your body time to digest. So I would say 2 to 3 hours prior to bedtime, you need to remain upright and do not eat. And that will help your symptoms as well.
Okay. So we've got a lot to get to. Let's see if we can cover a few more of these. So what are the benefits or downsides of ridding your gut of candida by using supplements?
So candida is throughout our body. It's in our mouth. It's in our digestive system. Some people know of candida causing oral thrush. It can cause esophagitis. It can cause vaginal candidiasis, a yeast infection. So it's there. The problem is when it overpopulates the area. So our digestive system has a fine balance. It's made out of trillions of microbes, and that's called your gut microbiome. So sometimes candida will start to thrive, and it can have side effects as far as your digestive system. So it can we found it could suppress your immune system. It can cause fatigue. It can cause bloating and weight gain. So the first thing that I recommend is that people take probiotics. Probiotics, Culturelle and a line or two that you can find over the counter. There's a wide variety of probiotics available, but they can help replenish that natural gut flora that aids in digestion. A lot of patients that we see that have candida overpopulation would be patients that have taken antibiotics because the antibiotics have killed the good bacteria. Also, people that use steroids, people with compromised immune systems. So it's a matter of finding that balance. And then additionally, some research has shown that particular foods may help with this as well. Foods that decrease inflammation in your body. So a list that research is saying could possibly aid in this would be cinnamon, which has antifungal and anti-inflammatory properties, garlic, apple cider vinegar, ginger, green leafy vegetables. All those are good for your diet. They're good for your digestion. So it can't hurt to try those along with the probiotics as well.
Okay, wonderful. This one is about colonoscopies. When should I start getting colonoscopies, and will my insurance cover it? And do all insurances abide by the new American Cancer Association's recommendation to start having a colonoscopy at age 45?
So the practice has been for people that are not at high risk. So people that do not have a positive family history of colon cancer, that they may start at the age of 50 receiving their screening colonoscopy, which is usually covered by insurance. The American Cancer Society just came out with new guidelines recently saying that age 45 is the new recommendation. Now, it depends on your insurance company. So the best thing for patients to do is to call their insurance company and ask what their recommendations are, what they will cover. But definitely, if a patient under the age of 50 has any concerning symptoms, they definitely need to come to our office and discuss with us their symptoms, because that would be, we would make a recommendation to perform a diagnostic colonoscopy. So some of those symptoms would be altered bowel function. Normally you go to the bathroom once a day and it's normal size, and now you're having 4 bowel movements a day, or you're only going once a week, or the size and caliber of your stool has changed, where it may be thin, it may be shaped funny, or you start experiencing a new onset of rectal bleeding. Or some patients present with anemia, just newfound unexplained anemia or unexplained weight loss, or maybe even chronic abdominal pain that's unexplained. So those are all reasons for people before the age of 50 to come in and let us interview them to see if it is recommended for them to have a colonoscopy sooner.
Okay. All right. Fantastic. I think we have time for one more question. We've got about 2 minutes left. So,
Okay.
What are the signs and symptoms of an ulcer? Is it dangerous, and is it something I should seek treatment for?
Definitely. So an ulcer is basically a disruption in the mucosa of your stomach lining or the lining of your small intestine, the beginning of your small intestine called the duodenum. So ulcers can cause major issues if they are not treated appropriately. Number one, they can cause bleeding. Number two, they can actually cause scarring in your lower stomach, which can cause a gastric outlet obstruction. Those patients present very ill with vomiting, and that needs to be handled immediately. It is an emergency. And then finally, the third emergency that an ulcer can cause is perforation. Which again is very serious. About 2 to 10% of ulcers develop perforation. So it's very serious. And we can diagnose ulcers via upper endoscopy. So you'll hear your physician talk about an EGD. That's where we go down into the esophagus, into the stomach, and into the duodenum. And our physicians look for ulcers. We can treat those. We just need to know they're there. There are 2 things that I want people to know about ulcers that are important. Number one, NSAIDs. A majority of the patients that come into our office have been taking NSAIDs that have ulcers. That would be ibuprofen, Motrin, Aleve, even aspirin products, Goodies powder, BC powder. We hear that a lot, and that can really get people in trouble. So try to avoid those unless you have to take them, and never take those on an empty stomach. And then secondly, there's a bacteria that we know of called H. pylori. We found that a lot of ulcers are actually caused by this bacteria, and a lot of times people do not know they even have it. So about 70% of ulcers are asymptomatic. People are walking around with this bacteria and they don't even know they have it. So we can treat that with what we call triple therapy. And that is 2 antibiotics, usually amoxicillin and clarithromycin, and a high dose proton pump inhibitor that will heal and treat the infection. So definitely pay attention to your body. If you have abdominal pain, bloating, nausea, feeling full fast, definitely pay attention to those symptoms. About 45% of patients may not even have heartburn. So heartburn may not be the exact symptom that people have with ulcers. So definitely they can be bad, and we need to be mindful to try to avoid those medicines that may increase your risk.
Okay. All right. Well, Kristen, we appreciate your time so much. Unfortunately, our time is up. So thank you for joining us today. And for our participants and listeners out there, if you have additional questions, you can message those to us through Facebook, or you can call and schedule an appointment at Low Country Medical Group. And the information is up on the screen now. So again, Kristen, thank you. And thanks to everybody who's joined us today.
You are very welcome. I enjoyed it. And I hope that you guys have a very successful day. Thank you very much.